Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Because when you're talking to your friends don't want to hear about teeth numbers, right? They just want to know that you got their back and you're going to take care of them. And so I feel like you said, that was one of the first lessons we picked up a long time ago. And yeah, you break it down into 3 links on a chain, but it's deeper than that because it's really, we use those links in a chain to build that relationship and really become friends.
Hi, this is Dr. Bruce Baird with the Productive Dentist Podcast with one of my good buddies, Dr. Wade Kifer. Wade, welcome.
Yeah, well, I'm glad to be here, Bruce. It's always fun to get to talk. It's been a little while since I've seen you, so always fun.
Oh, I know it'll be fun. We're gonna have a good evening. I'm really, we've started this new program called Clinical Calibration, and I know you're on the faculty, but I'm starting to realize how important, the things that we've been teaching all along, but how important they are day to day for every dentist out there. And we're getting that kind of feedback. It's kind of like we're talking about, initially talking about, that patient connection. And we've done that, and how do we do risk-based care and the stuff that you learned at John Coyce. And by the way, Wade is you're an instructor at Coyce. You're everything you could have done, you've already done at John's. So that's why we're so excited to have you as part of what we're doing with Clinical Calibration, because the doctors who've been in it up to now had just picked up so much. The other thing that really kind of strikes me is how things are changing so rapidly. And it's kind of like if you don't stay on top of this, you'll be behind in weeks or months, and I think AI is going to play a role there. What are your thoughts? I'm just throwing this out there, but I mean, what are your thoughts on AI and diagnostics?
Well, as we talk about all these things, I think they're all tied in together. I obviously started at PDA 12, 15 years ago and used to have this joke about all these repeat offenders that would come back, right? And so with things like Clinical Calibration Institute, it gives us the opportunity to be updated all the time. We're not waiting to come back every 2 years or 3 years and bring all the team. And so I still think in-person learning has great value in certain situations, but things like AI and in dentistry, things change so fast.
Yeah.
And, as John Coyce says, none of us is smarter than all of us, right? And so when we can get together and work as a group in some of these small learning environments and not wait for once a year meetings, I think it gives us a bigger chance to update quickly in those things. Because what do I think? I think it's the future. There's no way around it. But what does that look like? I don't know. Every day I think I've got something figured out, and it changes so fast that if we're waiting a year for an update on it, we're going to be behind the times.
As a clinician, are you frustrated with the high-risk patients that are in your practice right now who are not following through with your perio protocol? If so, we can fix this problem together. The Clinical Calibration Institute, powered by PDA, is hosting a free live mastermind featuring Dr. Tanya Dunlap of Perio Protect, September 30th, where she will teach you how to master biofilm control, pinpoint ideal candidates, and learn how to simplify results with the RX tray therapy. Go to clinicalcalibration.com right now to register for this free live mastermind event today.
Oh my goodness. Yeah. I put the handpiece down, as 6 years ago. I go up to the office. I just did veneers on one of my daughters last week, and I did veneers on another one of my daughters about 3 months ago. I haven't forgot how to prep. I feel super comfortable. I haven't forgot how to numb people up. But what's really crazy is just the software changes, just the stuff that I was using. I was kind of like, can you show me how this works? Can you show me how that works? And so I feel like, with AI, there's so much coming at, but it doesn't matter if you have AI if you don't have the personal connection. Wouldn't you say I mean, to me, patients are going to, I think that they'll value AI, but they won't value AI if they don't like you. You know what I'm saying?
Yeah, and that was one of the first things, as I talked about when I went through Productive Dentist Academy, it's almost like every time I went, I tried to pick up a new thing. And I got better at it, but one of the first things we picked up was you taught one thing and you said something that really stuck with me, and it was always that 3 links to a chain, right? Things we had to have in common. And you said, "I only treat my friends."
Yeah.
Right? And the links when you go in to do that new patient exam, they can't just be superficial if they're going to be your friends.
That's right.
You've really got to get down and link with the patients. And I know some dentists find that uncomfortableness, but there's a level of trust. I went from when I came, I used to go to the patients and go, "Hey, you've got these 3 surfaces. These are the surfaces of the tooth. We're going to treat the mesial, the distal, the occlusal." And I describe all these things in technical terms. And now I'm in such much better relationship with my patients that, you know, if they're nervous, I just say, "I've got you. Don't worry about it." Right. Or a line I stole from you is, "It's time. It's time we get this done." And I don't even mention teeth numbers anymore or anything, because when you're talking to your friends don't want to hear about teeth numbers, right? They just want to know that you got their back and you're going to take care of them. And so I feel like you said, that was one of the first lessons we picked up a long time ago. And yeah, you break it down into 3 links on a chain, but it's deeper than that, because it's really, we use those links in a chain to build that relationship and really become friends.
Yeah. I mean, I tell you, when it first hit me that I only wanted to work on my friends, and it was, I don't know, I was probably 15 years in, but I started realizing that it's that connection we're missing. I've got the clinical skills, I've got that, and guys that go to John or go to, wherever they go, they come out, they may have the clinical skills, but it's like going to the dance and not having anybody to dance with. And what I found was when I started really paying attention, and one of the things that I know you found too, but I would look back at the new patients I saw over the last week. Do I really remember them? Am I really working on my friends, that type of thing? Or am I just going through a script to supposedly make them say yes? Well, yeah, that's part of it, but I only want to work on if I'm a part of that trust and a part of that. They know that they're in the right place. I just did an exam. I went out and I said, I'm not going to do the work, but one of my good buddies here I play golf with, and he was like, man, would you just take a look at my teeth and stuff? I know you're not working anymore. I said, sure. Well, he and I already had the trust. So it was, and so all of a sudden it was like bringing in somebody who was already going to say yes to treatment just because I was going to say it. And you know what? It was, I didn't go through the risk factors like I usually do. I didn't go through all that stuff just because I felt like we already had that trust. But I think it's so important to have them understand that those risk factors, it's not that I just want them to know it. It's just that I want them to know that they may be part of the cause for what's going on. Does that make sense?
Oh, totally. And you said something. I always use this line when I talk to PDA sometimes. And I always kind of say, if I can make them cry, I know it's over. And I mean, that sounds terrible when I say it. And I do put that out there a little bit for shock value.
Sure.
When we do that, even on a new patient exam, first we've got that link, right?
Right.
But then all of a sudden, we're going to get deep with them, because we're going to go, "Hey, how long has this been bothering you?" And we're going to listen. I'm going to say, can you tell me a little bit more about that? Right. And I keep going deeper and deeper because I'll just say, how does that make you feel? Has that
Yep.
been, bet that's been frustrating? And then you listen and, you'll get all the way down to, I mean, is this affecting your life? Have you avoided stuff? And it's uncomfortable sometimes, but if you'll get deep down and, you can't just ask that first question, does this make you emotional? Right. But sometimes, but if you'll work it down with them, and then it's just sympathizing with them. Right. So we may not have talked treatment at all, but if you're willing to get emotionally involved, and sometimes that's you telling a little story about yourself, how that you've been affected by a situation, not to make it about you, but just to be vulnerable with the patients.
Absolutely.
Because that's what you do with your friends, right? You share with your friends.
That's right.
And, when you get that deep with a patient, by the time, like I said, if they're willing to vent all their frustration and fears and anxiety, at that point, all I got to say is, I've got you.
Yeah. I love
We're
that.
going to make it better.
I love that. I mean, I love that. And I'm from my perspective, it's kind of like, I went through probably the first 15 years of my career telling people what they needed, and then I'd step out of the room and hope that they said yes, which is, I know some of you guys listening to this, guys and gals listening to this, have been through the same thing, but it's like now I pretty much know they're going to say yes. They may not be able to do it all today or tomorrow or even this year, but I'm their dentist from now on. And when they can come up with the cash to do stuff, they will. If they can't, they'll find a way. And if they can't find a way, I'll usually find a way to help them. So it just changes everything with that trust, the risk factors, I think the personal stories we share, with the patients. What do you do? And you have really become a master of the risk factors. I mean, you really have. What do the risk factors mean to you in your communication strategy with patients?
Well, for me, I mean, you always taught us this line that, their problems are not our fault, right? It's their problem. And so, but even more so than that, when I look at the risk factors, I put their problems on their disease risk.
Yes.
And I actually take it off of them. And so I can tell a little story, and I got to meet someone through you, nonetheless, but Bradley Bale.
Yeah.
And Bradley Bale wrote a book called Beat the Heart Attack Gene. It had personal impact on my life because I had a heart attack when I was 37 years old. And so I tell patients that when I go through risk, I say, we look at your risk as your odds of developing trouble. And think of it like this. And I tell them about the book, and I go, there's a very important topic in this book, and it's called Beat the Heart Attack Gene. And I give my personal little testimonial on that, 30 seconds, not long. And, they're feeling sorry for me at that point. But I go, the beauty of the book is it says beat the gene, meaning some people are genetically predispositioned to heart disease. And you know that, right? Certain women are they're going to have the breast cancer gene, right? We all have things. There's a gene that makes you more likely to have periodontal disease. There's genetics that make you more likely to have cavities, even on just your 4 lower front teeth. Now, what's different is, and what that book is so powerful to me, it's beat the gene. I have to do extra stuff to beat the genetics. I have to eat right. I have to exercise. I have to take my medicines. I have to do all these things. And it is what it is. And you can say, yeah, that's genetics. I was fairly skinny, pretty good shape, 37 years old, and had a heart attack.
I remember.
You, the patient, have genetics for this. It is not fair that you're having to do extra. It is not fair that you're going to have to get your teeth cleaned 3 times a year, that you're going to have to bacterial testing and deep cleaning. But that's the genetics. We can beat it. If you and me team up and work together, we have a very good shot of beating it. And in your case, at least it's not heart disease. But if we don't get this under control, it could turn into heart disease.
Oh my gosh, I just love that. I've loved you taking your own personal story And, I do the same in a different way, but I think it's our responsibility as a healthcare provider to educate them not on mesial and distal, or not buccal and lingual, which I did the same, but educating them on the things that you were just talking about. I mean, that it's not fair. Some of us have had these issues and it's just not fair. But I have a I have a I have a plan that could help us, and help you keep your teeth the rest of your life. And golly, that is just, I tell you, it's amazing. And some of your patients only have one risk. Great. Some of your patients have a different risk. Might be perio. One might have the decay problem, and then there are those train wrecks that they have them all, and they're abusing themselves and their teeth and everything else. But what really kills me, what tears me up, is that most of the time, those that are just really tearing stuff up, they don't have a clue. They're just living, they're just living their life, and no one. And this is where it really hits home. And I know you hear this too. It's like, why has nobody else ever told me this?
All the time.
No other dentist has ever told me this. And you could easily say, well, no other dentist knows what we know, but that's not what we do, because it's not about that. I always look at it as, we're learning a new step every day. What we do in our business is, I only like to work on my friends, and you and our buds now. And it kind of changes from you being Dr. B or whatever. A lot of times they'll just call me Bruce. I said, that's great. I don't have that. There's no real hierarchy as far as that's concerned for me, but I always want to be their consultant. I don't really want to tell you what you need, but I want to consult you based on my knowledge on what I would do if it was you. I mean, if it was me in your situation. Is that kind of the way that you follow it, or whatever?
Yeah, because whatever the generation is of the patient, I mean, if it's a female my age, it's if I would treat my wife just this way. If it's someone older, it's like, this is what I do with my dad. I had a lady in today. She busted out 2 teeth. I'm like, she's 22 years old. And I'm like, if you were my daughter, this is exactly what I would do. And I mean that. That's exactly what I would do. So first you have to get in that relationship, and then it's relate that way. And I'm the same way. I introduced myself as Wade. I want to be on first name basis with you. I'm not trying to be above you. I am your consultant.
Fulton.
Then when I get with them, I'm like, I bet you're frustrated, because I'll tell them too. I'm like, I can look in your mouth and you have spent thousands of dollars.
I know.
And you're still having trouble. That has to be frustrating, doesn't it? Right? I want to be on their side as a consultant, not someone, and it's just the way we're taught in school, all of us. There's your problem, there's your fix. There's your problem, there's your fix.
Yeah. And what we found is that, and productivity, we're not doing it. I'm not doing it to be more productive. I mean, it happens. I do it because I know if I take great care of my patients, the money always has taken care of itself. Now, if I start to, try to nickel and dime people, whatever, and things don't work that way. But when we kind of converted our mindset into working on friends, and to tell them what I would do if it was me, I mean, I think that's always been part of our nature, to do that. We want to take great care of people, but the ability to be able to have a system in place. And now, good grief, I mean, we've had people come tell us about caries, and Kim Cooch has done an entire program for clinical calibration, 4.5, 5 hours. This is probably the leading guy in the world on decay risk. And
I don't know anyone better than Kim.
And he's been friends of ours for years. But for him to kind of put 5 hours of time into, and he said it's the first chance he's ever had. He's taught a lot of people about caries, but he said it's the first time he's ever been able to be a part of an overall solution or an overall calibration of treatment, which is kind of weird, but I can understand if you're in this lane, but now he feels very much so that he's a part of a movement in dentistry, and I do really like clinical calibration. I like what we're doing. I like the fact that your team can get on and get calibrated to the same thought processes that you and I have, that your front desk can hear things that calibrate them to understand dentistry in a way that, well, they didn't understand. They worked front desk at the bank, or whatever, and now they're in your office. They're really good. They don't know, and all of a sudden, you're taking your hygiene, you're taking your chair side, you're taking your administrators, you're taking people on the phone, and everybody now ends up with the same philosophy that we have built our business around. Do you find that the same thing when you're looking at it?
Well, yeah, that's exactly what I was trying to say earlier, and you just put in better words, because we would go back to PDA every couple of years. Every time we had a staff turnover and some change, and it's like, oh, we've got to get everyone back on the same page.
Right.
Right. And so we developed a whole program in our office and we've been doing this long enough, where we meet every quarter and go over different risk factor, right? So we get all 4 or 5 of them in a year. But it took years for us to set that up. And just to have it laid out in clinical calibration, where when you have staff turnover or changes or just need a refresh, because even all of us, I mean, I go back and learn the things I've always learned. I've heard Kim Cooch lecture so many times, and it could be the same lecture or the same time I've heard you lecture. I pick up something new every time, right? Because wherever you are in life, you hear something, whatever you need to hear is just one of my philosophies. So, no, I think it's brilliant that now we have, not only are we having live information, but we've got everything recorded too, so that, oh, you get a new associate, you need to hear what Kim said, and we can go back and pull it back up, and you listen to it with your new associate, you'll pick up something you didn't pick up the first time, I promise.
100%. I mean, I found that I love doing live programs, and we 21 years we've been doing 2 to 3 to 4 a year. But what's really interesting is kind of the same thing is I meet people and I learn something at each seminar that I'm supposedly being the teacher. I've learned so much from you and so much from the other people that have come to the programs. I'm going like, really? When did you start using that? Well, how does that work? And then I go back to the office. Now, the bad part now for me is I'm not going back to the office, but trust me, I'm doing my very best to stay as integrated with the new treatments and the things that are going on as I possibly can. Cynthia, my wife, she laughs. She goes, "Why are you looking at that? I'm on a video watching somebody do something." She goes, "Why are you doing that?" And I said, "Well, it's really interesting, man. They're printing these things and then they're doing this." And she goes, "Yeah, but you're retired. Just let it go." And I go, "I'm not dead. I'm a dentist. I love dentistry. I love my patients." And, you never know when one of your buds might just ask you, "Hey, have you heard of this new deal?" I don't want to be the dentist that goes, "Oh, that was, that's," I don't want to say it's no good just because I don't know it. What I'm going to say is, hey, it's pretty exciting. There's so many new things out there. So anyway, but golly, what a wonderful way to practice dentistry. Do you enjoy dentistry more now than ever?
Oh yeah. I mean, I'm still a general dentist, but I'm just getting to do more of the dentistry I like. And, it doesn't seem as stressful. Like you say, I'm at the stage of my career. I don't worry about, are they going to say yes or not?
Right.
I hear patients referring me new patients that never got the treatment done for whatever reason. Maybe they just wasn't time yet, but
Right.
there's no confrontation or very little, we're able to turn it back to we're on the same side. And it's just a much more pleasant way to practice dentistry. I look at some of my role models and, I could see myself 2 or 3 days a week as long as I can mentally and physically do it, but I enjoy PDA has given me a lot of freedom too. I'm probably 10, 11 weeks off a year. So it's easy to keep going when you've got it built and the systems. It takes time to build it that way. It doesn't happen overnight, but the journey's definitely worth it.
Yeah. Oh my goodness. It does. I got you, Wade. I just love that line. I'm going to start using that line a lot. So, everybody, I hope you guys have enjoyed Dr. Wade, because I tell you what, I enjoy visiting with him every opportunity I get. I'm so thankful for you and all the things that you've done. You've sent a jillion people through PDA over the last few years, 20 years, and I'm certainly appreciative of it. But I am just, I just love visiting with you. I love learning new things. And if you guys need anything, we're going to be doing some videos out of Wade's office on some of this stuff. I think you know that now, but if you don't, sorry to break it to you. But
I got some word. We're going to do some over the shoulders, and it'll be a lot of fun doing some risk factors and treatment planning and just how to set all this up in your office so that you're not having to reinvent the wheel. So
that'll be so much fun. When I was doing the over the shoulders, the one thing I would always get, people would say, well, you just seem so relaxed, and you're seeing a bunch of people, but you just seem so relaxed. And I think they expect it to be, if you're going to be a good producer and produce well, it doesn't take a lot of dentistry to do very, very well. Yeah. And if patients are saying yes to treatment, you're going to find you're doing very, very well. But it's getting to that relationship. It's getting to that trust. It's going through those things. And so, folks, I hope you guys have really enjoyed tonight. And we're going to be doing some more talks with Wade, and I'm going to get Wade to help out with our Productive Dentist podcast here in the future as we go forward. But thanks, Wade, for being with me today.
I love it, Bruce. I've learned a ton from you. Thank you.
Well, I've learned a ton from you too. So thanks, buddy. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.